that's predominantly how we think that the coronavirus is being spread. The droplets, thankfully, they generally don't hang around for a long time and they really don't travel as far. So you can be directly exposed to a droplet if you're coughed on or you're sneezed on. And I did want to forewarn you, this is probably the most graphic image of the whole presentation. So that's from the CDC. But that's just to sort of display the importance of why we want to cover our sneezes and our coughs. But also droplets can be transferred indirectly. So the droplet can, if we cough or sneeze into our hand, and then we go and shake someone else's hand, they can then receive the virus from the droplet that's on your hand. And then we've also found that the coronavirus does live on surfaces. So there was a study that came out from the New England Journal of Medicine that looked really a little bit more specifically at what surfaces and how long. And it does look like it's more stable on plastic and stainless steel compared to copper and cardboard. So plastic or stainless steel might live up to about 2 to 3 days, and cardboard for 1 day. So I don't know about you, but that can be really scary. You just think, gosh, I picked this up. I don't know, someone might have coughed on it 3 days ago and I'm gonna get coronavirus. A little bit of context into that study, when they looked at the number of viruses that were present at that 72-hour marker, it was less than 0.1% of what was originally there. So, as sort of common sense would have it, more of the virus dies off as time goes on, and they're simply reporting that they could detect the virus at less than 0.1% of what was originally there in 72 hours. The other thing that I wanted to clarify about that study was that it was performed in a laboratory with controlled temperatures. So it was 21 to 23 degrees Celsius, which is roughly 70 degrees Fahrenheit. So it was in a laboratory condition and not necessarily in real world settings. So moving on to airborne diseases are transmitted via droplets as well, but they're very tiny, tiny, tiny droplets. So the sort of scientific definition of it would be an airborne particle has to be less than about 5 microns, which a micron is 1,000th of a millimeter. So tiny, tiny. But because they're so small, they can hang in the air for a little bit longer. They can spread over larger distances. Thankfully, it seems to be a little bit less of a concern with coronavirus. So in that same study, they said that an aerosolized particle of the coronavirus might last in the air for up to 3 hours. The huge silver lining about that is that like we discussed, most of the droplets that we are forming when we cough and sneeze are larger particles. So they're too dense, they're gonna fall to the ground. Where it becomes a little nuanced is when folks are in the hospital and they're performing procedures that will aerosolize the virus. So if you think about nebulizers or ventilator machines, suction, those sorts of things will predispose folks to contracting the virus that way. So that's just one reason why we definitely want to leave those N95 masks for our healthcare professionals that are caring for the really sick that are in the hospital, because they definitely need protection against those airborne particles. I think on the day-to-day, you probably don't have to be wearing a mask when you're feeling healthy. The main issue is going to be when you're feeling sick and making sure that you're maintaining that 6 feet of distance to prevent other folks' droplets from being exposed to those things yourself. I did want to say, in terms of the airborne diseases, the most common one actually is measles. So that's incredibly contagious, as we know, and every one person that gets measles can infect up to 15 people. For coronavirus, thankfully, the initial estimate seemed to be that for every one person that's infected, you can infect about 2 others. And then just for comparison's sake, the flu is a little bit lower than that. For every one person that's infected, you could infect about 1.3 other persons, which sounds funny, but it's just sort of what happens when we talk statistics. So yeah, with all of the other statistics that I'm going to be presenting today, these numbers are really still being figured out. And so I just want to make it clear that that's sort of what we're finding now, but it could change as we find out more about the virus. So how quickly does it spread? So this slide can be a little daunting. Every person with COVID-19 can approximately infect 2 people, which we just talked about. So in essence, the infection rate doubles about every 6 days. If 10,000 people have the virus today, in 6 days, 20,000 people will have it. In another 2.5 weeks, about 160,000. And then less than a month later, it can be over 2.5 million people. Experts say that they expect about 40 to 70% of people to become infected in the US. I do want to say that those numbers are when there aren't really any protective measures going on. That's what you want to be thinking about when you're looking at numbers like that. How do we prevent the spread? So we know it can spread pretty quickly. How do we prevent that? This graphic is sort of a comic relief for what's going on. But on the left side, it shows someone that might not care less about the coronavirus, whatever it says. It's just like a cold or flu. And in turn, you see that the healthcare system is filled to capacity. On the other side, you see a woman who, I really like her speech bubble. It says, "Don't panic, but be careful." She's washing her hands. She's not touching her face. She's staying home when she's sick. And the healthcare system capacity is full, but it's not to the point of overflowing. So that's something that we really want to stress is, maybe you might not end up a healthy 30-year-old or 40-year-old might not end up very sick, but we do want to prevent the spread of the virus to more vulnerable patients that will end up in the hospital and that will really overload the healthcare system. That's what we're seeing in Italy. It's an incredibly dire situation there, and that's exactly what we want to prevent from happening here in the US, and especially in Columbus. So what is considered social distancing? The CDC has actually pretty a good definition for it: remaining out of congregate settings, avoiding mass gatherings, maintaining distance about 6 feet from others when possible. And what's neat about Columbus as of now is that you can do all of these things outside. So it doesn't necessarily mean you're homebound, that you really can't do anything, but you can get out and do things. One caveat that Megan had brought up was that it might be a good idea to encourage our kids, if they're in outdoor areas, playgrounds and parks, to let them, run in the field or bike on a path, but to take care when they're using highly used areas in the public, like the playground. Again, this could change based on, what local government officials say. Obviously, this is not the case in New York or California or Ohio or in some countries abroad. But for now, this is the case for us. What is an incubation period? You might have been hearing this term about coronavirus. It's the amount of time that a virus can live inside your body before you develop symptoms. And it seems like coronavirus can average about 4 to 5 days in your system before you exhibit symptoms. Now, the CDC says we want to quarantine for 14 days if we think that someone might have it. And that's because the longest duration that people have shown before showing symptoms while infected with a virus was about 11.4 days. So that 14 days is a sufficient amount of time to cover that whole period of time where you might be infected but not showing any symptoms. Let's say you are worried that you might have it. What sort of symptoms could you have? There was a really neat study that China did really quickly. It was very impressive, of about 70,000, a little more than 70,000 patients from the main hospitals in Wuhan. And they looked through some of the clinical symptoms that patients were having. And like we've heard from the CDC, fever and cough and respiratory symptoms were definitely up in the top three. So let me just explain this slide a little bit. Fever was present in about a little less than half of the folks that were admitted with the virus upon arrival to the hospital, upon admission to the hospital. And then throughout their hospitalization, at least 90% developed a fever. Um, Cough and respiratory symptoms, about 70%. And then there are some sort of interesting studies coming out about GI symptoms. Loss of appetite seems to be a large one, which might not necessarily be GI in nature. When you even have the flu, you can feel like you don't really have much of an appetite, but that has been prevalent in a lot of the sick folks that they saw. Diarrhea, there's some interesting articles about that too. It looks like about 4% of people presented only with diarrhea. So generally, you're going to have some sort of upper respiratory symptom and diarrhea. But a very small proportion of people presented with just diarrhea. And then recently, we've seen in the news loss of smell, or anosmia is the sort of scientific term for that, can also present. That was these are anecdotal cases, so there's no official study that's been done about that, but there are a couple of professors out of the Ear, Nose, Throat Association in the UK who noticed that this was happening, and so they put out a press release about it. So that's still unknown, but it seems to be people are becoming more aware of that. Okay, what do we do? What do I do if I think I have it? The first thing is definitely going to be call your primary care provider. Please call first. Do not come into the clinic. The second option that you have is to call the appropriate line. So the Muskogee County Health Department is screening folks for coronavirus. And if you meet screening criteria, they're able to get you set up for testing actually through MercyMed. So that's the number that you would call, 706-321-6300. And if you're an Alabama resident, EAMC is providing testing, and that's the phone number to call for that, 334-745-5765. I want to explain a little bit about how testing works. At first, it was really only the CDC that had the appropriate sort of chemicals to run the test, but they distributed that to commercial labs. So the two main labs that are doing that in the US are Quest and LabCorp. They also are currently overloaded with tests that have been submitted. And so it was a little bit difficult to get results back initially, taking more than 7 days just because of the backlog of the tests that they had received that they had to run. But it sounds like they've opened 2 or 3 more facilities to run those tests. And so we have noticed that the results are coming back a little bit sooner if they're sent to certain labs. So the turnaround time seems to be more like 2 to 3 days. The test itself is what's called a nasopharyngeal swab. So it's just like the flu swab. You get sort of a long Q-tip inserted through the nose until it reaches the back of the throat. And then that sample is sent off in a refrigerated container to the Quest main laboratories where they'll test for that. What's kind of exciting is that this week the FDA did approve 2 different rapid PCR-based tests. One is called Cepheid, the company is called Cepheid, and those tests will run within 45 minutes. And then Mesa Biotech will have tests that run within 30 minutes. And I don't think that they're set to be released until about March 30th. But it's exciting because, as we know, testing has been sort of the rate limiting factor for getting the disease under control. And so we're excited. We're hoping that this will help us to manage all of this better. In terms of the, oh, sorry. back a slide, Billy. Thank you. In terms of the accuracy of the test, there's not a lot of good data out yet. One article I was reading was saying the nasopharyngeal swabs might be about 63% accurate, which is pretty low. And it was comparing it to samples that were taken from within the lung from really sick people in the hospital. So that being said, if you can have the disease and still test negative, because the tests aren't that fantastic. They're not 100% accurate. So if you have symptoms, or if you know that you've been exposed to someone that tested positive, it's definitely appropriate to take the right precautions in that setting. All right, William, ready for you. What about treatment? So potential future treatments. And I do want to sort of put a big disclaimer out there that all of these options are still in testing. There's really nothing that says for sure 100% this is going to work. But they are options that folks are looking into. So I just wanted to make that clear. The first one that's on the list, chloroquine phosphate. Chloroquine and hydroxychloroquine, they sort of sound the same. Those are medicines that we use. Chloroquine we use typically for malaria. Hydroxychloroquine we usually use for inflammatory diseases like lupus or rheumatoid arthritis. So these are pretty strong medicines with pretty strong side effects. But it looks like they tested 100 patients with the chloroquine phosphate. And that it did show some improved lung imaging findings, and that it shortened the disease course. They also tested azithromycin, which is a common antibiotic that we use, and added to hydroxychloroquine, which seemed to help eliminate more of the virus. Remdesivir in vitro. So that means that they tested it in the lab, but they really haven't tested it outside the lab. And inside the lab, it looks like it does pretty well. So you might be hearing about some folks receiving that treatment when it seems like life-saving measures are not doing the trick, or turning sort of the tide of their disease. And so that's sort of being used as a rescue measure, but it's certainly not approved as a treatment across the board. The last one is lopinavir, ritonavir. This we usually use to treat HIV. And there was one study that showed that there were decreased ICU stays, but number of days in the ICU, but that it really didn't affect the total number of days that people felt symptoms for. So, yep, those are some of the options that they're testing. Are we safer outside of the metro Atlanta area? This is something that's sort of been on my mind. I put a little screenshot of an image from the Johns Hopkins interactive map, and it shows that Muskogee County has got 4 confirmed cases. So that's pretty good. That's not too bad. In the world, there's 441,000, just as a reference. In the US, there's 55,000. And as of noon today, there is about 1,250 in Georgia. So of those 1,254 are in Muskogee County. I think that because we're in a less densely populated area, it could decrease the likelihood that we see, really catastrophic events like New York or California. Can't bank on that, but it's just something I'm sort of thinking about. And I think that we're getting into social distancing. So there is a city, Gwangju. Billy, if you could go on to the next slide. Thank you. Yeah. So Gwangju is about 2 hours south, a 2-hour plane ride south from Wuhan, which is where the epidemic started. And if you look at those cutouts, Wuhan in the Hubei province had 67,000 confirmed cases. And Guangdong, which is in Gwangju, had 1,400 confirmed cases, so a lot less, 8 deaths versus about 3,150 deaths, 3,160, I'm sorry. So could be that because we're practicing social distancing. We're about 2 hours south from New York, which is where the majority of the epidemic is right now. I'm hopeful that if we take preventative measures seriously now, that we could see that we could see control of the disease better here in Columbus. Alrighty, how likely are people to die from coronavirus? So I do want to remind you that about 80% of cases are going to be really mild. So people might feel a little bit ill, they might not feel at all ill and get better. And those people are not going to be tested. And so they're not going to be included in the total number of cases of folks that have coronavirus. So I think that eventually this number is going to go down because the total number of people that have it are going to go up. That being said, I do want to go through these little tables. So on the left, you see that coronavirus is the last row. The fatality rate, which is the fourth column of data, says 4.4%. So that is pretty high, honestly. It's less than Ebola, it's less than SARS, it's less than MERS, but it's fairly high. The table on the right shows us that it really actually depends where you're living. So if you look at Italy, the death rate is 7.94%, so that's really high. And then in the US, about halfway down, it's about 1.68%, and that was data from March 17th. The experts sound like they're saying it's going to go down to about 1%. So the fatality rate from coronavirus will be about 1%, is sort of where we're thinking we'll end up. I do want to say, if you go into the next slide, it compares it to the flu. So if you look at the age distribution, both illnesses prove to be more deadly in our older population. But in general, if we say that about 1% of folks are going to die from coronavirus, the flu virus, in comparison, about 0.1% of people die from the flu. So that data, in sort of an easy way to understand it, makes it seem like coronavirus is actually 10 times more deadly than the influenza virus. And that's what the data is showing right now. Again, could change, but that's what it looks like. All right, and then for these, a couple slides from here, I'm gonna pass it over to Megan Melnick, who's gonna tell us about what we can do to care for ourselves at home. Is that good? Okay, Billy? Yeah.
Go ahead, Megan, we can hear you.
Okay. So this is stuff that is on the CDC's website. Everybody's heard it a lot, but just for the sake of reiterating and agreeing with what they're posting. But if you are sick, even if you have not been tested, but you think you may have been exposed, you have a cough or fever, and you're not able to get tested because of limited resources, we want to remind you to stay at home, but also to stay separate from the rest of your family if possible. So, no, not everyone always has their own room, but if you do have your own room, stay in your own room and bathroom space. If you can't do that, then doing a little partition or at least wiping down surfaces really often with a disinfectant, because like Joyce talked about, that virus can live on surfaces for quite some time. Keeping out of the living room. If you're homesick with a cough and fever and you think you may have it, don't watch Netflix with everyone in the living room or cook dinner for everybody. Let them bring meals to you until you are better. we always talk about coughing or sneezing into our elbow, which is better than our hand. But if you have tissues, even better, because then we can get that virus onto the tissue and the tissue into the trash instead of a lot of times we miss our elbow or it goes under the elbow and all those kinds of things. And then some just normal cough and cold things, making sure we're drinking lots and lots of water, staying well hydrated. Viruses like coronavirus can elevate your heart rate, and staying hydrated is an important part of keeping your heart rate down. Hot tea with honey, lots of healthy nutrition, so fruits and vegetables as usual, and then getting your sleep. And then one kind of important caveat Joyce was mentioning earlier with coronavirus, if it is can be aerosolized by procedures and things. So if you use a nebulizer at home because you have asthma or COPD, you want to do that in a separate space than everyone else so that we're not risking aerosolizing those particles. And then kind of similar stuff, but to prevent from getting sick, all the things we know, washing our hands, teach your kids to sing their alphabet or happy birthday while they have soap on their hands. Don't let them get all the soap off and then just rub water together. Use an alcohol-based sanitizer, not touching our faces, wiping off lots of surfaces. One thing we've talked about a bit is wiping off things that you bring home from the store. So if you go grocery shopping, not a terrible idea to wipe some of those items, especially the plastic ones, down, just because we don't know who coughed or sneezed on them. Not to go crazy with it, but just to be mindful of what your hands touch and then not touching your face. Sleep is hugely important in keeping our immune systems boosted. So at least 8 hours a night, if possible. And then again, staying well hydrated, lots of fruits and vegetables, and then getting good vitamin D. So vitamin D is linked to our immune system as well. And so it's best absorbed through sunlight. So Joyce said we can go outside. We just don't want to get within 6 feet of other folks. So go outside, get some good 15 minutes of sun rays. If you can't do that, then a supplement over the counter is fine as well. And then I think the next slide, Billy. Thanks. And then we do know that most folks will be able to stay home and treat themselves and be okay. But when should we think about going to the emergency room? Because not everyone with a cough or fever needs to go. But if you have a high fever, 105, that's not getting better with Tylenol or Motrin, we definitely want to go at that point. Febrile seizures, so this is more common in children. Persistent pain or pressure in the chest, difficulty breathing. When we're doing phone triage, a thing I always kind of do to test patients if they're truly short of breath is if they're having to gasp or take a deep breath to finish their sentences. That is a sign to go to the ER. If you have blue lips, or if you notice that your family member or loved one who's sick has new onset of confusion that they don't normally have, that would definitely be a sign to go to the ER as well. I think that's all in there. And I'm going to give this one back to Joyce for a second.
So I put together a list of reliable sources of information. There's a lot that comes out from the media, and there's actually some sources that are coming about how certain medications will help prevent coronavirus, and a lot of that is not true. So I just wanted to point us to reliable sources. For parents, there's a podcast called PediaCast with Dr. Mike. He's really easy to listen to, has got really good input, so it's a good resource. For adults, the CDC, WHO, and Johns Hopkins are really helpful. For providers, all of the above, but also Hippo Education, they have a series right now where all of their COVID resources are free. Usually you do need a subscription to be able to log in, but everything there is free right now. And then for public health, the Georgia Department of Health, they have a daily status report that gets updated at noon and at 7 p.m. every day to show us what the numbers are like in Georgia. And then that Johns Hopkins interactive map is really neat, shows you what's going on around the world and statistics in that way.
Thank you so much, Joyce. Thank you, Megan. Just a quick reminder, folks, if you do have questions, we're compiling those now. So be sure to use the chat feature and send those right on through, and we'll respond to as many as we can, and if not, we'll do a little research if we can't answer it. But I wanted to say, I didn't mention this in the slide, but I wanted to mention that one of the ways we've responded to COVID-19 is we've taken a lot of extra precautions here at the clinic. We screen everybody before they come in. We make sure that folks are protected as far as the staff goes, as well as patients. We switched to a lot of telemedicine appointments for some of our elderly folks, and also for people that just don't have to come in. So we know that there's still day-to-day things that need to continue to be taken care of, and so we're doing our best to adapt. And so huge shout out to our staff and everybody who's on the line, who's been who works here and has really done a great job of of adapting and responding. And then, of course, we're doing testing. So we've done over 50 tests for, we've done I don't know if I'm saying it right technically, we don't do the tests here, but we've sent off over 50 specimen to be processed. And so we're here and we're open for business. And so if there are things you need, please don't hesitate to reach out. Speaking of reaching out, just wanted to throw this slide up there, and you might be aware of more of these that are happening, but there are a lot of ways to get involved right now, and a lot of ways to find help if you need it. And so the first one I'll mention is the Community Foundation has partnered with the United Way. They've created a coronavirus response fund, and I've put the link there. But if you go to the United Way's website, it's a great source of information, as well as the Community Foundation of the Chattahoochee Valley. And then also the United Way all the time has plugged into wonderful nonprofits, and they do great work themselves to serve those that are underserved in our area. So please, if you're looking for ways to get involved, that's a great place to start. In our neck of the woods here in our office, we're right on the corner of the North Highland neighborhood, and so Truth Spring, as well as Take the City, they've really taken the lead, along with Open Door Community House, and the Mill District, and Fox Elementary School, to make sure that there's a lot of services available to our neighbors. And so Feeding the Valley is our food hub. Red Cross, I know, needs help with donations. Columbus Baptist Association has a huge network that we're tied into, because our second location is located there, and there's a big kind of rally that a lot of churches are doing. Safe House Ministries has stepped up in a large way by providing shelter to the homeless in this difficult time, and there's many, many more. So if you know of other resources, or if you're looking for places to go, please take a minute, look at these wonderful organizations who are in need of help, in need of volunteer opportunities. And I'll mention this too, on the other side here, there's a lot of businesses that are still hiring in light of the difficult times. So you can just take a look and familiarize yourself with those companies. So our town and our community, I know even we have folks on the line from far away. I think that our country is responding in a way that's extremely generous. We're seeing that every single day here in Columbus, and so we just appreciate you guys and love you guys, and just know we're here to help in any way we can, and I want to point you in the right direction if you'd like to join us and join in providing some assistance. So I think that concludes our first part of the presentation. I'm going to turn it over now to Dr. Scarborough. Grant, if you're on the line, I'm going to turn it over to you. Again, guys, we're still getting questions that are coming in, really good stuff. So as Grant is talking, please feel free to keep those questions coming. And we'd like, though, in the midst of this, to just have a moment to center ourselves on God's word for a minute. And so Grant, we'll let you take it from here, and then we'll go to the Q&R.
Can you hear me okay? Give me a thumbs up, Billy. Thank you, Billy. And once again, this is the last part before we do Q&R, so please feel free. There's the very bottom, a chat thing that you can hit and ask Billy questions. here at MercyMed, we do take care of folks physically, but also we think there's a very spiritual aspect to who we are in our being. And I'll be honest, this is sometimes this can be a scary time. Some of the facts that Joyce was putting up there, I was thinking, go to the next screen, go to the next screen, because it can make us anxious. So one of my favorite verses in scripture passages comes from Luke 12, and I'll paraphrase a lot of it, but really what it's saying is, Jesus is speaking, and he's telling folks, do not worry, do not anxious, do not worry about what you'll eat, do not worry about what you will wear. And right now, a lot of us are worried. What will we eat? Will the grocery store have enough food for us? We might be saying, what can we wear? Maybe what can we wipe with? Where's the toilet paper? And so there's definitely some anxiety going on among myself, my family, and a lot of the friends that I've spoken with. And Jesus is saying, do not worry about what you eat. Do not worry about what you wear. Look at the birds of the air and how I feed them. And look at the flowers of the field and how I dress them. And Jesus is saying, you have a great Father that loves you. And then comes up to Luke 12, verse 30. For all the nations of the world seek after these things, and your Father knows that you need them. Instead, seek his kingdom, and these things will be added to you. In the midst of anxiety, in the midst of worry of coronavirus and disease and all this, I feel like Scripture is really clear. We're called to seek first God's kingdom. Well, what is God's kingdom? How do you define that? To me, I would define it as, hey, it's Jesus. It's Jesus and all his blessings. It's Jesus and all his friendship. It's Jesus and all his kindness. It's Jesus and all the work that he is doing here on this earth and in heaven for his glory and our good. It's everything that we were created to be. That's what his kingdom is. And Jesus says, don't worry about what you eat or wear. Don't worry about diseases. You seek first my kingdom, and I'll take care of all those other things. Our job is to seek first Christ's kingdom. I love another little passage. It's a parable Jesus says. He says there was a man who was walking through a field, and when he was walking through the field, sorry, Bill, this isn't on there yet, but that's all right. As he was walking through the field, he found this treasure. And Jesus was comparing this to the kingdom of God. He found this treasure, it said, that was worth more than everything else he owned. So he went back, and he sold his donkey and sold his house. He sold everything. And his friends were probably thinking, why are you selling everything? And his response was, you haven't seen the treasure. It's more valuable than everything else I own. And Jesus said, that is what the kingdom of God is like. It's more valuable than everything else that we have here. And so the reality is, for us, the kingdom of God is the greatest thing we can have. And it's what's going to carry our soul into eternity. And God, who began a good work in us, will bring it to completion. It's his promises for us that he will never leave us nor forsake us. That's God's kingdom that we live for. The verse that's on the screen now is the next verse that says, fear not, little flock. Man, don't we need to hear that today? Fear not, little flock. I just picture this mother hen bringing the little baby chicks around saying, fear not, it's going to be okay. It's your Father's good pleasure to give you the kingdom. Don't fear. Seek Christ's kingdom. And it says here that he will give you his blessing, his benefit, his love, his kindness, his friendship. This is one of my favorite verses in Scripture. The next verse I don't like as much, because the next verse reads, sell your possessions and give to the needy. But it's a great verse, because if we have all the blessing of God's kingdom, if we have his kindness, if we're secure in him, guess what, guys? We can live open-handed. We can live in a way that we can give to others, that we can share what we have, that we can take time out of our day to love our neighbor, because God's given us his very best, which is him and his kingdom. And because of that, we can live freely. So in the midst of a coronavirus, knowing that we're secure with his kingdom in Christ, that means we can love our neighbor. We can walk across the street and socially distance ourselves 6 feet and see if somebody needs something. We can call and encourage someone. We can go and serve somewhere, because God has loved and given us his best. We're now able, in the midst of even coronavirus, to love others. So I just want to encourage you that, and know that you're not alone if you're anxious, but there is a great solution, and that's to seek Christ and his kingdom, and God will give you everything else. And so blessings. I will now turn it back over to Billy, and he will, I think, help us with all the questions that we have.
Grant, thank you. And yeah, that was, I think we all just appreciate so much the encouragement there. And it was that's really great. You know, I don't know if anybody's ever prayed over Zoom, but I think, Grant, why don't we just have a quick word of prayer, if you don't mind, and wrap this up, and then we'll move into the Q&R. Grant, will you pray for us? If you're
Yeah.
driving, don't close your eyes. If you're driving, just keep watching. Keep listening. Keep listening.
And it's beautiful in scripture. I think it says, "I do not fear," about 300 times. And every time it always follows it with, "because I am with you." So Father, I thank you, Lord, that in the midst of anxiety, you are with us and we are not alone. That you, if we seek your kingdom, that you give us the very best of you and all your blessings and your friendship and your kindness. And Lord, we just receive that. So Father, give us courage. Help us have courage to step out and love others and care for other people and lend a helping hand and serve and even give our best away to bless the person next door. Lord, thank you for this time. Thank you for Joyce and Megan and Billy. And thank you for everybody here listening in your name. Amen.
Amen. Thank you, Grant. So I'd like to ask Joyce and Megan and Grant and Sarah Barr to go ahead and unmute. And if any other providers are on the line, please unmute. And we'll start fielding these questions. The first one, Joyce, I'm going to put this first one to you. This comes from E042984. When will we know if we have flattened the curve enough to resume our normal daily activities like school?
Yeah, this is a really good question. If anyone else has input from our staff, I'm more than happy to open up the floor. It's really interesting, actually. So I think I'm thinking of a report actually that came out of England. It's called the Imperial Report. It's what actually started the US to get really serious about coronavirus. And from that report, actually, they were theorizing that we would have to do some sort of social distancing, maybe not all of the quarantining that we're doing, but in sections of time. And that those times would come based on number of cases in the ICU. So they simulated a whole country, basically, in this artificial intelligence system. And what they found was that when the ICU case numbers were dwindling down, you could open up. You didn't have to be so careful about quarantining and about protection and precautions, and that this actually developed a time period where people could develop something that's called herd immunity. So it means that if you're exposed to the virus and you develop antibodies to it, then you're protected from it. And so it gives people a chance to develop that immunity. And then the report goes on to say, and then the ICU cases would go up, and then the social distancing measures would be back in place. So how feasible is that? What does it actually look like? I don't really know, but it's sort of, I think it makes a lot of sense. We do, need to build up protection to the virus. We don't want to just quarantine ourselves forever, and we can't live that way. At some point we're going to have to come out of the woodworks again, and we'll be in the same situation that we are now. And so I think it's going to take more detail than just okay, we can go back to school now, or okay, we can relax social distancing measures. I think we'll see it sort of fluctuate, honestly. Yeah.
Cool. Thank you, Joyce. Dr. Barr, Dr. Scarborough, anybody else want to add anything to that?
I'd like to add, I think Joyce gave an excellent answer.
Yes. Agreed. There's a little emoji you can add, a clapping hands.
To answer that question, we might have to put her in office.
Okay. Let's see. Dr. Barr, I'm going to go to you with this one. Kurt is asking about allergy season. So it says, with it being allergy season and some symptoms of bad allergies may be similar to those of COVID-19, along with allergy-induced asthma. How can you tell the difference between the two, allergy versus COVID? Good question, Kurt.
That is a good question, and we are definitely dealing with both of those at this point. Certainly, I would say if you've had allergies before and it happens every year and you're just getting the same symptoms again and nothing else, don't worry about COVID in terms of being infected with it at this point. If you're having allergy symptoms and you start getting a fever, it could be COVID, it could be the routine flu, it could be other things. And so it's just to be more aware and be really careful about that. If you're getting a lot of, like she said earlier, the difficulty breathing, fevers, and those types of things, be a lot more in tune to that in terms of could this be COVID or some other flu virus or something as well. But that's really the big thing. Is it just sneezing, runny nose, itchy eyes, a little bit of a sore throat, and that's about it? That's probably your allergies acting up then, because it's definitely that season down here.
Thank you, Sarah. All right. This next question comes from Brad. Is COVID-19 expected to be a recurring illness we deal with going forward, similar to the flu? I'll put that one out to the group of providers. Anybody want to jump in on that one?
Joyce, you might, I mean, I don't think we know yet. I know the coronavirus, the other common colds, there are about a quarter of them. They are coming back every year. I would assume this might, but I don't know if we have any data to support that yet. Do you know, Joyce?
Yeah, I think most of the information is pointing to the fact that the hope is that it'll get better while we do quarantining measures now, and that it will surge again come this fall with the winter, and that it'll hang around, that it's not going to go anywhere, that it's still going to be here next year and the year after that. And so the hope is that, you know, the vaccine can be developed quickly, that we can really find out what treatments are helpful. I think it will be around. And it's interesting. I think that I had talked about, you know, detecting number of cases and who gets infected and things like that. And, you know, maybe you've been infected and we don't know. There is a way to test for that. There's a way to look in the blood for certain antibodies to the coronavirus. So if you carry the antibody, then obviously you had to have been infected at some point. And the hope is that more and more of us will develop antibodies as the years go on, and we won't have to be, you know, really sick when it comes back.
Yeah, I think that's a good point. This is novel to us now. We've never experienced it. And the next time it comes around, we won't have such a strong reaction to it because we'll have the antibodies to start fighting it much quicker.
Awesome, thank you. This next question comes from Amanda. Her question is, as a healthcare provider, do I call on behalf of the patient, or does the patient call to be screened? So let's see, Tony, are you on the line? Do you want to tackle this one? Tony Wynn, our COO.
Yeah, so if a patient is feeling that, you know, he or she has symptoms, I recommend calling the provider's office. They can triage you over the phone and direct you what step. If they feel like, you know, it is corona, they probably direct you to the health department, get screened, and then bring you here at MercyMed where we can collect the specimen. But that's what I would recommend if a patient is feeling, you know, those symptoms. Definitely call your primary care office before going there.
Amanda, does that answer your question? Do you want to? Because that is a good question in terms of what does the healthcare, you know, other PCP offices like. Amanda, if you want to come off mute and maybe expound on that a little bit, or just make sure we address that, because I think that, you know, in general, we want to, you know, we send folks to the health department to be screened first, and then they call us to schedule a drive-through screening. Hey, go for it. Yeah, thank you.
What we're truly trying to figure out is, and we see patients at our clinic, and so we're not, of course, letting anybody in with a call, but we're kind of getting conflicting information. Do we have the patient call the number that y'all gave us, and let them talk to them and they're screened and then they get the appointment with y'all? Or are we calling and talking to the health department for the health department to say, okay, they need to go and give the appointment? We're getting conflicting information from our people. Who calls the health department? The patient or the provider?
Yes. Go ahead, Tony.
Yeah, so the health department has a tent set up. You can direct the patient to go down there and get screened, and they can make that determination and set up an appointment with us. So that's one method of doing it.
So they don't call and are screened over the phone to see about going down there?
No, I think if the phone it depends on how many phone calls they're getting. Sometimes they get a busy signal and they can't get through. But probably the best thing to do is go down there and just drive down there. They have a tent set up to where they screen folks.
Okay.
Thank you.
Yeah, that's a good question. Thank you. But if you ever need us, feel free to call us. We can give you our number offline, and we can make sure you get what you need. Let's see. So Katie has asked, asking for a friend, smiley face emoji. If we have mild allergy-like symptoms, sore throat, etc., should we get tested, or does that just put unnecessary stress on healthcare providers? Let's see, Megan, do you want to take that one?
Yeah. So Dr. Barr answered this pretty well earlier, but I do have a chart that we'll post on our Facebook page and Instagram, and it's on our website actually already under our COVID response tab. There's a post for parents, and there's actually a chart on there that differentiates symptoms between flu, common cold, COVID, and allergies. And so in general, like Dr. Barr said, if you normally have seasonal allergies and you know this is what you usually experience this time of year with a dry cough and itchy throat, I would say definitely don't need to get tested. It would put some unnecessary stress, not so much just on us, but just on the limited number of tests, especially right now. But if there's, unusual fever, worsening coughs, that shortness of breath, and especially if you've been around someone who's been tested or positive, that would require a test. So hopefully that answers, and I'll get that chart put up. I think, Billy, it might be on the slides that I can, if you scroll down a slide or two, it might be on there. But I'll post it on Facebook as well. So don't worry about it.
Is it that one?
No, it's all the way at the bottom, but that's okay. I'm going to put it on Facebook for us.
Thanks.
Thank you.
Well, Katie, if you'll be sure to tell your friend that answer, that would be helpful. Well, folks, we are just past an hour, so I'm going to go ahead and wrap things up. I really appreciate y'all taking the time to join us for the call today. This is good. This is really good. We want to be able to stay in touch with y'all and keep the conversation going. So we will create some kind of routine for follow-up. We don't know yet. Maybe a survey monkey we can send out, or maybe just keep it on social media to see what the next steps might be. It's important for us to be helpful. So if calls like this are helpful, we'd love to hear from you and let us know, and we'll do it again. But y'all's participation really means a lot to us. Be on the lookout for the recording of this. If we can, we'll put it back out, and either the audio or the video of the meeting, probably just the audio. It's a little bit easier to upload, and that way we can have it to refer back to. But we'll be in touch. Y'all let us know if we can do anything for you. Anybody on the MercyMed side have anything else to add or say before we sign off?
Hey, Billy, that question that Sarah asked real quick, I did post an answer just in the chat. But the CDC does have some specific guidelines on when you're clear. So if you've been home quarantined and you're not hospitalized, right now the CDC is saying if you can't get tested again, which really you can't because we don't have enough tests to test people who are symptomatic, but you want to be fever-free for 72 hours without medications in your system. You want your cough and shortness of breath to have improved, and you want it to be 7 days at least since your symptoms first began. So hopefully that helps a little bit.
Good deal. Thank you, Megan. Okay. Oh, Sarah. Oh, I just saw that I missed Sarah. I'm so sorry, Sarah. Megan, thank you for bailing me out. Okay, well, guys, we're going to go ahead and log off here. Y'all take care, and we hope to see you soon.
Thanks, guys.
Thank you all very much.